One of the questions that would come up was, would I be willing to see this person? And it raises an interesting question. How does willingness to see relate to fitness to practice? And there are some crossovers there, but I'm going to focus on the key difference, which is that willingness to see is a situational decision. So am I willing to see this particular professional in this particular setting? Well, okay, I know that they behaved abominably towards a colleague, perhaps. And maybe that is a minus point against them. But other factors may weigh in there. Maybe it's really urgent, maybe it's really critical. Maybe I know that actually they're technically very good, and what matters to me right at this moment is the technical ability, and I don't like them as a person, I don't think it's good, but maybe that is my priority in this situation. Maybe the nature of the procedure means that I will feel more or less vulnerable with this person. So willingness to see is going to depend on a lot of these situational considerations, and we can see that very clearly as participants talk about it. It seems wrong that fitness to practice should vary by the situation that a patient is in. Fitness to practice is something separate from that. And the reason I can say that with confidence is that the members of the public we spoke to themselves identify this as a case. So I'll just draw attention to one participant who was very clear about, we were talking about a scenario involving a particular professional who behaved in some ways that most people found quite shocking. And this person was saying, yeah, but if I wanted them to actually, I wanted them to fix my teeth, actually I'd still go to them because it's quite hard to find a dentist and maybe my teeth would be really hurting. And when we asked him, well, what about if you run a fitness to practice panel? He just said, oh, well, that's completely different. That's completely different because a fitness to practice panel isn't making that judgment about do I get my teeth fixed by him. They're making a judgment about his attitude. And as far as I can see, the attitude's clearly wrong. So he was clear that this person wasn't fit to practice, but even so, he might make that situational decision to go and see them. If you look at what people think about the behaviours and the scenarios that we looked at in this research, then you're going to see a huge diversity of responses. So what people think varies a great deal. But where we find the patterns is if you instead look at how people think about them. So the kinds of tests that they apply, the kind of categories that they use to make sense of these behaviours, and the kind of arguments that they use to derive at an evaluation. And the way I think about it is to say that what we're seeing across all these people is what we might think of as the thinking of a reasonable person. And I'm using it in that sense that I believe lawyers use it. They talk about what would a reasonable person do. So we're seeing various categories and arguments that even if they didn't agree with the decision, the participants that we'd spoken to would say, well, I follow the argument. That's the right way to be thinking about it, even if we might come to slightly different conclusions. So one way to think about it might be to say that you have here in the categories, the constructs, the arguments that our participants use, the beginnings of a sort of toolbox that can be used to make sense of these cases. It doesn't remove the difficulty of coming to a right answer, but it does give you the steps that you could use that would then be seen by those other people as being, well, those are sensible ways to approach the topic.
So we feel the report highlights various issues that we think panels ought to take into consideration. These types of cases are not straightforward. There are various issues that panels have to take into account, just the context, how people have reacted, how people have responded to complaints made against them. And the report just sets these areas out, and I think it's lots of food for thought for a panel. One of the issues that the report raises is there a difference between a banter and a culture of bullying? To look and unpick what the registrant's motivation is and was, and also, was this the first time a registrant had behaved in this way, or had they behaved in this way before and been told that this behaviour was inappropriate and been asked to stop or go to a course and address this issue, and have they continued regardless of that? One of the factors that came out was how a registrant addresses their failings and how they remediate and how they reflect on these issues. The panel should give proper consideration to whether this is a one-time error which has been effectively remediated. And when we talk about effective remediation, we're talking about more than attending a course. We're talking about genuine and heartfelt reflection and understanding why they acted in the way that they did and the impact this behaviour has had, and how they will work to change and not repeat that behaviour.
In terms of next steps, we'll certainly be considering the findings of this research and seeing how it fits into our policy work internally. We may be looking to review guidance or considering how it fits into our other work around harm prevention in the workplace, or thinking about how the implications of this research might impact on our future priorities for research and policy work. The research will also be useful in considering what the impact might be of unwanted sexual behaviour on public confidence, whether public confidence is likely to be damaged by certain behaviours, but also trying to disentangle some of the concepts which may be relevant to public confidence. For example, whether someone's willing to see an individual practitioner or whether someone feels that such behaviour crosses a threshold. This research may also be useful, we feel, in feeding into regulated standards of behaviour for professionals and considering how standards can support professionalism and support positive team culture, but also ensure that behaviour which may cross a boundary or cross a threshold can be dealt with as appropriate. We hope that this report may also be useful for employers and perhaps managers to consider how to manage such behaviour in the workplace and to consider how they both set appropriate standards and manage compliance with standards, but also encourage a healthy and positive team culture.